Welcome to our TAPT technique for arthroscopic hip labral reconstruction and augmentation, retrograde passage, tie anterior to posterior, and truncate. The following are our disclosures. The patient is positioned supine on a traction table with the perineal post with fluoroscopy coming from the opposite side. 3 standard hip arthroscopic portals are utilized to access the joint under fluoroscopic guidance. Additionally, a proximal modified anterior portal and posterior lateral portal are utilized for the reconstruction. A standard diagnostic arthroscopy is performed, which in this case revealed a diminutive labrum not suitable for repair. Spinal needles are utilized to establish the proximal modified anterior portal on the left and the Dalla portal on the right. A cannula is placed in the proximal modified anterior portal. A beveled rim prep technique, as described by Dome et al., is utilized to help better restore the hip labral suction seal. A peroneus longus allograft is prepared with a fiber loop whip stitch on one end and ripstop mattress sutures with monochrome on the other. 1 to 2 1.4 mm peak anchors are placed medially, which will be used to pass the graft into the joint. The sutures from the most medial anchor are passed out of a cannula in the modified anterior portal. Sutures from subsequent anchors are passed out of a cannula in the proximal modified anterior portal. 1.8 mm knotless all suture anchors are then placed sequentially medial to lateral along the rim. The sutures from these anchors are passed outside the proximal modified anterior portal and snapped sequentially with hemostats for suture management. It is helpful to view from the modified anterior portal and work from the anterolateral portal as more lateral anchors are placed. To begin to pass the graft into the joint, a posterolateral portal is first established with a spinal needle and sequentially dilated using a switching stick and dilator. A sled is then placed over the switching stick. A suture limb from the most medial anchor is then passed out of the joint via the sled. A free needle is then used to secure the suture limb to the end of the graft outside the joint, as depicted here. By pulling on the other suture limb from the same most medial anchor, along with the help of an arthroscopic grasper, the graft is shuttled into the joint. The 2 suture limbs from the most medial anchor are then tied arthroscopically. Proceeding medial to lateral, the suture limbs from the subsequent anchors are then passed around the graft and any native labral tissue and secured appropriately. The authors prefer to incorporate any remnant native labral tissue into the reconstruction in order to increase the amount of collagen in the construct and help restore a better hip labral suction seal. The same principles are applied utilizing the knotless suture anchors where the conversion stitches are passed into the joint around the graft and native labral tissue, and then the repair stitch is shuttled using the conversion stitch in a manner that inverts the graft and native labrum. Here we can appreciate the graft and native labral tissue being secured to the acetabular rim. This illustration highlights how passing sutures around the red native labral remnant tissue and blue allograft maintain continuity of radial fibers in the reconstruction. Again, it may be helpful to switch to viewing from the modified anterior portal to secure the most lateral suture anchors. With the sled as a backstop, a radiofrequency device is used to amputate the graft. Any remaining sutures are then cut, the construct is inspected, and traction is let down, visualizing restoration of the suction seal. The authors prefer a T-capsulotomy to appropriately assess for any cam morphology. A round, diamond-tipped arthroscopic burr is utilized to perform the femoral osteochondroplasty. Once satisfied with the labral reconstruction and femoral osteochondroplasty, the capsule can then be closed using an arthroscopic suture passer and arthroscopic knot tying techniques. Thank you for your time and attention.